Started. Well, thank you all for being here today as we talk about all things respiratory here with Jennifer. Just a couple housekeeping things before I get started. We will be having your cameras off and microphones off as well during Jennifer's presentation. But if you have any questions as I'm going through any of this or as she's presenting, feel free to throw all those questions in the chat or in the Q&A feature at the bottom. We've got some time set aside at the end to get all of your questions answered that you have here for Jennifer. But we're so excited to have Jennifer here with us today. She is a respiratory therapist at St. Luke's Rehabilitation Medical Center. So we really appreciate Jennifer you being here with us today. And go ahead and take it away and get started.
Okay. Hello, everybody. My name is Jennifer. Like she said, I am a respiratory therapist, and then I am also a certified cardiac rehab professional. And like she said, we are going to talk about kind of all things lungs today. So the first thing that we are going to discuss here is going to be the basics of your lung system. So to understand how any disease process in your lungs work, we first have to understand how they are supposed to work, how the lungs should function normally. So the primary function of our respiratory system is to exchange gas, and we breathe air in, we exhale CO2. The respiratory system also serves as the first host defense for any barriers between our external environment and our bloodstream. So the lungs have pretty unique qualities in the fact that they do try to prevent as much getting into our bloodstream that we may be breathing in to keep us as healthy as possible. The pulmonary system is made up of a few components. So there is a phrenic nerve. That phrenic nerve travels down from our brain every time our brain says we need to take a breath. So if your CO2 levels are getting slightly high, your brain says, hey, it's time to take a breath, let's lower those. That sends the signal down, and that connects at your diaphragm, which is a dome-shaped muscle underneath of your lungs. And that dome-shaped muscle then contracts, and that pulls air in. So think of opening a door and the air flowing in. And then when that muscle relaxes, to exhale, it pushes those lungs back up and pushes the air out of your lungs. You also have your upper respiratory system that a lot of people forget is a part of that. So when I say that, I mean your mouth and your nose, which is kind of one of the first defenses is your nose. You have little hairs in your nose, and those are there for a reason. So make sure they stay there. And those are just to kind of filter out some big particles. So the little hairs in your nose help to filter out some of the bigger dust particles that we breathe in. And then the rest of our lung system helps to filter out some other dust particles, the smaller dust particles. So it also humidifies the air we breathe. Our lungs don't like cold, dry air. So it heats it, humidifies it so that our lungs are happy with what we're breathing in. And then you have little tubes in your lungs. So in the picture there, you'll kind of see those branching off. And as those branch off, they get smaller and smaller, and those lead to what we call alveoli, which are little air sacs at the ends of your lungs. So kind of like grapes on a vine. And those alveoli is where air or gas exchange happens. So those all connect up to a red blood cell or a blood capillaries, and the red blood cells travel through there. So if the air isn't getting into those little air sacs, there's no gas exchange occurring. If there's damage to those air sacs, it'll make it more difficult for gas exchange to occur, which means you're not getting as much oxygen into your bloodstream, not getting as much CO2 out. You also have cilia inside of those little bronchioles or those tubes. And those are like hair-like projections, which help to move the mucus up into our upper airway. So along with that are the mucus glands. So those mucus glands produce mucus on a regular basis, just normally, so that anything that got past our nose and made it deeper into our lungs, the mucus travels through and picks up all those really small particles The cilia moves that through our lungs to kind of roll through and pick anything that may be in there up. And then every day we do a little cough, get it up into our upper airway and move about our day. So that's normal. Coughing is normal. A little bit of a clearing your throat is very normal. That's just our body working as it should. So now that we know how the lungs should function and what they should do, what is COPD? What does that look like, and how does that affect us? So COPD stands for chronic obstructive pulmonary disease, and this is an umbrella term for any obstructive lung disease. When you, or if you become diagnosed with COPD, generally they're talking about two main forms. So there's many different types of obstructive lung diseases. However, the two that we are discussing, or the two that are the most common, are chronic bronchitis and emphysema. So emphysema is caused when those little air sacs in your lungs become damaged for various reasons, or they become stretched out. So the walls may become damaged and one air sac becomes or 100 air sacs become one big one, or that one air sac can get really stretched out. And when that happens, they get really floppy. They're not very stable. And so they'll tend to collapse at the entry point of those, and they hold air into them. So that's called gas trapping. And that just makes it really hard to get air in. So think of an already full balloon. So when you have a lot of gas trapping, the air gets stuck in the lungs and it's hard to get it out because the air, those alveoli are collapsing at the entry point. And when you can't get air out, you can't get more air in if your lungs are already full. This specific diagnosis, so emphysema, this specific type of obstruction, is diagnosed with a PFT, so a pulmonary function test. And that's when you sit in the doctor's office, you'll go to a pulmonology office, and they'll have you breathing on a tube. They may put you in a little box and have you do some different breathing exercises just to test how your lungs are functioning, to see how much of an obstruction you have, to see if you have any gas trapping or any blockages in there. The other main form of COPD is going to be bronchitis. So chronic bronchitis is inflammation in your airway. So those little tubes in your lungs become inflamed and narrow. And then you also have a lot more mucus production. And the reason for that is your body's trying to clear whatever secretions may be in there, or trying to clear whatever's causing the inflammation. So your body's trying to correct the situation. And sometimes when our body tries to fix a problem, it overcorrects. And so when it's overcorrecting, it produces too much mucus. And with the inflammation and the excess mucus that is being produced, it causes blockages in that airway, which makes it hard for air to pass through those narrow tubes with lots of mucus that is also blocking it. And you can see that on the picture. You can see both of those on that picture. Again, this can be diagnosed. So the symptom is a chronic cough for at least 6 months is the main indicator that you may have chronic bronchitis. And then they will do pulmonary function testing to determine if you have an obstruction of some kind. And then they can also do a CT or a CAT scan. And that is to also determine if you have any, how severe the inflammation and that blockage is. So we're going to talk about kind of some myths that come along with COPD, things that people may not really understand. So a lot of people think COPD is just an elderly population. Just as we get older, it's more likely to be, in the 60, 70, 80 range, which is not true. So COPD is not usually diagnosed until you're around age 40 or later. However, signs and symptoms can start to show in adults as young as 20 years old. So it's important to know the symptoms, important to talk to your doctor and get treatment. The sooner that we can diagnose and treat you in that mild form of COPD, the better your outcomes are going to be, the better your longevity will be, and the better quality of life you may have. So symptoms of COPD are going to include a cough. It can be a chronic dry cough, or with mucus, so a productive cough, wheezing or noisy breathing. So if when you breathe, you kind of hear a whistling sound pretty often, that can be a symptom of some sort of obstruction occurring. Chest tightness or shortness of breath comes along with that as well. And then unusual tiredness. So if you're way more fatigued than you have been in the past, that's a sign that something's going on in your system. And you should definitely be talking to your doctor about that, regardless if it's COPD or not. Because when our body is fighting to have something function correctly, so when our lungs aren't working correctly or our heart maybe not working correctly, we'll get more tired because our body's using a lot more energy to help that organ function appropriately. So if you're having more fatigue than you normally do, and it's kind of all of a sudden, and it's noticeable to you, that is definitely something to discuss with your doctor and get some testing done. Second myth is COPD is only caused by smoking, which is not true. So 1 in 4 people that have COPD have never smoked. They may have secondhand smoke or other exposures that can cause COPD. However, they have never smoked themselves. Smoking is the most common cause of COPD, which is where that myth comes from. But other causes can come from premature birth, childhood exposures to secondhand smoke. So if you rode in the car with your parents and they smoked a lot in the car or at home, you are more likely to have COPD as you age. Childhood asthma is another one. We are seeing a lot more of what we call asthma COPD overlap syndrome, where you will have both asthma and COPD, especially in our elderly population that had asthma as children, and now they're having COPD. So that is a big contributing factor. Childhood respiratory infections. So if you're chronically ill, had chronic maybe pneumonias or bronchitis as a kid, or if you had upper respiratory infections all the time as a child, that is an indicator that you may get COPD as you age, and something to watch for and talk to your doctor about. Pneumonia, tuberculosis, HIV associated COPD. So if you have HIV, you're also more likely to have COPD. There are genetic forms of COPD, which is called alpha-1 antitrypsin deficiency. This is a form of emphysema that is caused by a genetic deformity. So you can get COPD regardless of having any exposure to smoke. So if you are having, especially as a child, if you notice maybe your child is having a lot more shortness of breath than you would expect they to have, that is definitely something to talk to their physician about and get some testing done. And then exposure to poor air quality and air pollutants. So if you live in the Northwest or really kind of anywhere in the country lately, we have had significantly more wildfires, which definitely increases everybody's risk if you are breathing that in to have COPD later on or damage to your lungs. Next myth that we're going to talk about is that it's too late to quit smoking if you already have COPD. So I already got diagnosed with COPD, so I might as well just keep smoking. What's the point at this now? Which is not true. So every cigarette causes more damage. So cigarettes actually break down the lining of those alveoli, so the lining of those air sacs, which create that one big air sac. So cigarette smoke can break that lining down. It also paralyzes the cilia. So those little hair-like projections in your lung that allow that mucus to move out, cigarette smoke paralyzes those, which is why there is a smoker's cough. So when you stop smoking, those cilia, if they're not damaged by too much mucus building up, causing them to be broken or bent, they will become unparalyzed. They'll start to wake up and they'll start to move. And you'll get more mucus that has just been building up in the bases of your lungs, and you're going to cough that up. And that is that smoker's cough, which should get progressively better when you quit smoking over time as your lungs clean themselves out again and kind of get rid of all that built up mucus that has just been sitting there for so long. And then we're going to talk about, so people think that it's too difficult to exercise with COPD and that exercise isn't going to help them in any way. So regular exercise will actually improve symptom management. So the more efficient your muscles are, the easier it is to breathe because they're not going to demand as much from your lungs. So the more you exercise to an extent, the stronger those muscles become, the more efficient those muscles will become with using oxygen and producing CO2, and your lungs aren't going to have to work so hard to keep up. So if you have a chronic lung condition, regular exercise, staying active definitely helps with that. What tends to happen is people who have a lung condition and they experience that shortness of breath, which can be absolutely terrifying to feel. They'll stop exercising, they'll reduce their activity levels. And then what happens is your muscles become more deconditioned, and then they're going to demand more from your lungs at lower levels of activity. And so that shortness of breath catches back up to you. You're going to feel more short of breath at lower levels of activity. And then it just becomes this vicious cycle of reducing your activity levels to not feel that, and then it getting progressively worse over time. So we definitely want you to exercise and get kind of into movement. So regular exercise, 20 to 30 minutes, a few times a week is really important for cardio. And then getting in some strength training as well. So muscle building exercises, which pulmonary rehab is a great way to start with that. So if you have a chronic lung condition and you are more deconditioned, you feel like, I really don't know where to start, or I don't really feel like I can do anything, just walking to the bathroom, I get really short of breath. That's where pulmonary rehab can really come in and benefit you, because we will help you learn what you're watching for, symptom management, all of those different great benefits to get back into exercise and kind of improve your symptoms with COPD. We're also going to talk about oxygen. So there's a lot of myths that kind of come around oxygen, or things that, people just inherently believe. So oxygen therapy actually does help you breathe better and be more active. So when you have a chronic lung condition and that gas exchange isn't occurring as it should, you're more likely to build up CO2, which causes that shortness of breath, headaches, muscle fatigue, dizziness, lightheadedness, excessive just fatigue in general. And when your oxygen's dropping, that allows that CO2 to build even faster. And when your oxygen drops below 88% when you're active, your body will shunt that blood flow away from your extremities, like your arms and your legs. And it's like putting a tourniquet on those. Because it's going to get the oxygen to your vital organs. Your body then, when it's low enough, your oxygen's low enough, your body doesn't care if you're walking or using your arms. It just wants to make sure all your vital organs are getting enough oxygen at that point. And so those muscles will actually be deconditioned even faster than they would if you had an appropriate amount of oxygen in your system while you're exercising. So that's where supplemental oxygen can come into play. Getting that supplemental oxygen, if you are dropping below 88% when you're active, can allow you to do more activities and allow you to build that muscle back up to be more active in your daily living and improve your quality of life. A lot of people think supplemental oxygen is addictive, which it is not. It doesn't have any addictive properties to it. Your body doesn't get used to having it. Because we all need oxygen. That's a normal part of living. And like I said, having a chronic lung condition can make it harder for that gas exchange to occur, harder to get the oxygen into your system where it needs to be. So having that supplemental oxygen can definitely help with that. However, just like any other drug, too much oxygen for too long can cause adverse health conditions or adverse health events like stiffening of your lungs, or what we call free radicals to be released in your body, which can cause other organ damage. So if you are on oxygen, it's important to discuss that with your primary care physician or your pulmonologist and make sure you're not using too much. A lot of people think, I'm on 2 liters and that feels great, so 4 liters must be better. And that's not always the case or true. So definitely discuss that with your provider and follow that prescription as they have recommended. And then traveling with oxygen is very possible. You just have to plan properly. So if you're flying, they do require that you have a portable oxygen concentrator that is FAA approved. That portable oxygen concentrator is what is going to help make sure that there's no explosions on a plane. So, because compressed tanks and compressed airplanes don't mesh well together. So Having that allows you to fly. The one general rule that they have with flying is that you have to have twice as much battery life as flight time. And that's so that if you get stuck on the runway or you get stuck in the air circling for a while for whatever reason, if there's a layover somewhere unexpectedly, that you'll have enough oxygen to get you through that additional time that you may not have planned for. Beyond that, make sure you talk to your doctor about traveling with oxygen and any proper protocols in place for that. And calling, if you are flying, call your airline, discuss with them, get to the airport early because they are going to check to make sure it really is an oxygen concentrator. Don't ever check any oxygen supplies or any other medications because those may get lost. So keep those on your persons and make sure that you have them with you at all times as needed. And then a lot of people believe oxygen is flammable, which is also not true. So oxygen is an accelerant to a fire, which is where you get the stop, drop, and roll from, because we're trying to smother the oxygen. We're trying to smother that fire, which will help put it out. So fires need three key components. One is oxygen, one is heat, or a spark. So oxygen, heat, and a spark are going to be your three main components to starting a fire. So when you have excess oxygen in the air, that does accelerate that fire. So it will go faster with the excess oxygen, but that doesn't make it flammable all by itself, which is why you just have to be careful to avoid any open flames or heat sources. So baseboard heaters, stoves, cooking in the kitchen, if you have like a gas stove, or keeping your oxygen away. With your provider, or if you go to pulmonary rehab, we can help you kind of learn how to mitigate that and still be able to cook in the kitchen without that increased risk. That's why you never want to smoke with your oxygen on, because smoke does provide that spark and heat, which with the excess oxygen that pools around your face can definitely start a fire. And it has happened. And then with that, if you do use oxygen, you never want to use a petroleum-based lubricant, because petroleum is an accelerant or is flammable for a fire. So with just the friction of the cannula moving on your face and having petroleum jelly there and the excess oxygen, it happens very rarely, but it can happen that could start a fire and cause a spark, and which would then start that fire. So making sure we're only using water-based lubricants, because oxygen is very drying. It will dry out your nose. So you may need to use something to help manage that, which would be the water-based lubricants. They do sell them specific for oxygen, which is called air. You could also use just like KY jelly, is a very easily readable water-based lubricant that is very beneficial for patients. So those are kind of the big oxygen topics. And then pulmonary rehab. So does it really help you? We have talked about this a little bit already. However, pulmonary rehab can be very beneficial for patients. So anybody who has a chronic lung condition, insurance does have some requirements. So Medicare requires that you have moderate to severe COPD with pulmonary function testing that shows that. If you have a private insurance or a commercial insurance, they may have different guidelines or recommendations for that and allow you to attend at different levels. Other diagnoses that we see pretty commonly are going to be asthma, chronic bronchitis, emphysema. So again, those are COPD diagnoses, the chronic bronchitis and emphysema. However, if you don't fall into that moderate to severe category, we may still be able to get you into pulmonary rehab. Pulmonary hypertension, interstitial lung conditions or disease, cystic fibrosis, lung cancers. If you've had a lung volume reduction surgery, pre or post your lung volume reduction surgery, you can attend pulmonary rehab. So that's where they go in and they remove the portion of the lung that is severely damaged, which will help shunt blood flow to the healthy parts of your lung, which improves gas exchange and quality of life. Restrictive lung diseases, and then post-COVID with continued symptoms. They have added that in the recent years as well. And then Providence, which is where I work, we do have a pulmonary rehab program, which is, we follow evidence-based. We are AACBPR certified program, and we will monitor your vitals. We do different education topics, emphasizing disease management, prevention, symptom reduction, all of those, and kind of help teach you how to manage your lung disease and get back into exercise. And our patients, and this is true for kind of nationwide as well, do show improvements when they attend pulmonary rehab in exercise and strength, shortness of breath, quality of life, emotional health, which is also a really big aspect of your lungs. And our program specifically tends to score above 96% in patient satisfaction with their rehab experience. But there is generally a pretty high patient satisfaction across the country as well, and benefit for all pulmonary rehab. And then, as mentioned previously, exercising with COPD in other pulmonary diseases definitely can reduce symptom management and improve your quality of life, which is the big goal. We can't, unfortunately, reverse lung disease. However, we can reduce your symptoms and improve your quality of life, and hopefully stall that lung disease progression to give you some more time with less symptoms. And now we're going to talk about kind of the concerns that come along with poor air quality from wildfires. So that is going to be the big thing is smoke from wildfires are especially harmful in young children because their lungs are still growing. Older adults, as they tend to have just normal wear and tear. So after about the age of 35, your lungs just start to naturally decline in their function, just from normal wear and tear of using them every day, all day for 35 years. So it's very gradual, it's very minimal. However, that is also normal. So the older you get, the less lung function you tend to have. And then patients with asthma, COPD, bronchitis, chronic or acute, or chronic heart diseases or diabetes. Those all tend to be very affected by poor air quality from wildfires, as anybody can be. So particle pollution is one of the many pollutants that are in wildfire smoke. And they're very, very tiny. So as you can see in the picture there, they're about the third of a size of one single strand of hair. So they can travel very deep into your lungs, lodge all the way down in there and cause some damage, which can cause, if you're exposed to it for a prolonged period of time, asthma attacks, heart attacks, strokes, and they may increase coughing, wheezing. You are more likely to get like bronchitis, so acute bronchitis, which works the same as chronic, it's just a shorter period of time, and then colds in children. So kids may get ill more frequently, or chronic, like an upper respiratory infection more often, the more they're exposed to wildfire smoke. And then carbon monoxide is also found in it's a gas that's found near fires or in the smoldering stages of a fire. And when you inhale this, that carbon monoxide, it's very similar to carbon dioxide, which is what our body normally has. It's just more harmful. And so in low moderations or kind of smaller amounts, concentrations, it can cause headaches, nausea, dizziness. That's a good sign that you kind of have been exposed to that carbon monoxide. Same goes for house fires or gas leaks in your house. In higher concentrations, it can lead to premature death because your organs and tissues are not getting enough oxygen and they can no longer function appropriately. Other pollutants can also be spread in wildfires, causing an increased risk of other illnesses and harmful to our system. And then how can we reduce our exposure? So unfortunately, wildfires do happen. So if we're living in an area that has that, or even in an area where we've had it happen, where there's been a wildfire over here in the Northwest where I live, and the smoke travels all the way over to the East Coast or up into Canada. So, or vice versa. So what can we do if the air quality is poor? Big thing, stay inside as much as you can. So using an air purifier in your home, keeping your doors and windows closed, making sure to block off any areas that may have a draft. So kind of under the doors, if you have leaky windows, blocking those off with a towel or tape or something. One that people tend to not think about that does go to the outside is dryer vents, so smoke can get in through there as well. When we have smoke or wildfires in my area, I tend to turn on the fans in my house, so those in the bathroom and in the kitchen to kind of help filter out some of that air as well. And then using an N95 mask, if appropriate for you. So surgical masks and dust masks don't help in wildfires because they don't filter small enough particles. So for the pollutants that are exposed in wildfires. So using an N95 mask is going to be the best option if you do have to go outside. However, if you have a chronic lung disease or a heart disease, make sure to check with your physician first, as N95s can make it more difficult to breathe. And if you already have a hard time with that, we don't want to make that worse. So definitely talking to your physician in regards to that. And then taking extra precautions to keep children away from poor air quality as much as possible. So I did talk about this previously already. However, their lungs are still developing. They breathe faster than adults do, which means they're going to breathe in more of those pollutants just with their faster respiratory rate. So they are more susceptible to have more damage from that. So making sure that we try to keep them out of that as much as possible. N95s typically are not approved for children just because it is so hard to breathe and they tend to not be able to take those off as easily. So definitely talking to their pediatrician before using one and make sure that that is appropriate for your child. And then keeping your car windows rolled up if you do have to be outside, switching the air circulation, which a lot of people also forget, to inside the car only. So instead of pulling air in from the outside, because that's just going to pull in those pollutants, make sure you switch that filter inside your car. No exercising outside if the air quality is poor, regardless, because when you do exercise, you do breathe faster and you inhale deeper. And so you're going to get more of those air pollutants if you're trying to exercise out in that poor air quality. So try doing exercises inside, like a sit and be fit, or there are some great videos on how to walk a mile in your house. There's plenty of exercises that you can try to do inside, or you can go somewhere that has filtered air if you can make it there safely. So like the gym, if you have a gym membership, or going to the mall, they usually have mall walking where you can just walk around the mall. And then you can monitor the air quality through an app or a website. So there is the airnow.gov app, or it is a website as well that you can go to, and that's going to help give you what the current air quality is in your area. It also kind of lets you know what's to be expected for the next day. You can look up if you plan on traveling, what the air quality in that area is going to be, so you can plan your trip and any adjustments to maybe your itinerary in that. And then also on the weather apps, a lot of the weather apps will also show you any air quality concerns, so you can look on there as well. This is a list of my different references. So a lot of this comes from respiratory school, learning about that, but also from the Cleveland Clinic, the American Lung Association, all of those great websites. So you can always find this information elsewhere as well. All right, does anybody have any questions?
Awesome. Thanks so much, Jennifer. Great information. It's so helpful to know, especially as we're about to head in directly into that wildfire season. I
Yes.
just have one question for you that was messaged to me here in the chat. Going back to that pulmonary rehab, someone here is interested in it and just wanted to know a little bit more, or if you could reiterate this a bit about the process to get registered for that. So if they're interested, do they have to go to their provider? Do they need a referral, or how do they get enrolled in that?
Yeah, that's a great question. So to come to pulmonary rehab, you do need a referral from your physician. It doesn't have to be a pulmonologist. It can be your primary care. And then just as long as it's documented in your medical record, your lung condition that qualifies you. They will send that to the pulmonary rehab of your choice or in your area. And then once they get that referral, they will give you a call and schedule you. Every rehab does it differently. Some do group evaluations. Our specific program does one-on-one evaluations for pulmonary rehab. So you'll meet with a clinician, set different goals for why you're wanting to come to rehab, what you're wanting to achieve. And then we'll get you set up into a group class and help you get exercising from there.
Great, thanks, Jennifer.
Yeah.
That is the only question that I'm seeing. So if anyone else has any other questions, or maybe I missed any, feel free to put them in the chat. Oops. And right as I say that, I think we got one in here. Someone is asking in the Q&A, how about smog? How damaging is smog?
So smog can also be very damaging to your lungs in regards to, again, it's going to be smaller particles. It is like air pollutants. So any air pollutants definitely cause damage to our lungs. I like to tell my patients the only things that should be going into your lungs are clean air, prescribed oxygen, and prescribed pulmonary medications. Shouldn't be breathing anything else in. So that includes kind of anything over the counter that they may be offering, anything along the lines of like the oxygen bars. I'm not a huge fan of those. Things like that. So smog definitely falls into that same category. Generally, smog is a little bit bigger particles than wildfires are. So you may be able to get away with using a surgical mask. But if it is excessively smoggy outside, I would try to stay indoors and avoid any exercise outside in that situation.
Okay, great. Thanks,
Yeah.
Jennifer.
Of course.
How about vape pens? Someone is asking here in the chat. Can you tell us how vape pens are affecting individuals who use them and anyone around them?
Yes. So there's not a lot of information as far as like secondhand exposure to vape pens. However, vaping can definitely cause a lot of lung disease over time. So the nicotine itself is what causes a lot of the damage and also increases your risk of heart disease. So any form of nicotine increases risk of lung and heart disease. I know there are vapes that are just supposedly just water and flavoring. However, those can cause what we call like a popcorn lung, which is significant damage very quickly to your lung disease or your lungs, and make it very hard for oxygen and gas exchange to occur, and make it hard to get the air in and out. So I generally recommend no vaping. It is not a benefit to quitting. So I know it was pushed for a very long time to help you quit smoking, to use a vape. However, what they've found is one, vapes are not as regulated, and so you don't really know how much nicotine you're getting at once. And two, we tend to use them more. So, or you end up doing what we call dual. So you'll smoke cigarettes and vape, and you tend to increase your nicotine exposure, and you increase your risks when you use a vape pen. So I highly recommend, even if it is just technically what they call water and flavoring, one that's not regulated, you don't really know what you're breathing in or the damage that can come from that. So I recommend we don't use those. And with that, if you're trying to quit smoking, I would recommend using either dual therapy, so long acting like Chantix or a patch, and then a quick acting as well is what they have found. Studies have shown to be the most beneficial, because for the sudden cravings that you may still get while you're on a patch or Chantix, you're going to need a quick acting like the gum or a lozenge, or they have nicotine inhalers to help with that, to slowly reduce your usage. With that, exercise is also very beneficial to help you quit. So cigarettes are extremely addictive. Any nicotine is very addictive. And that's because it binds to the dopamine receptors in your brain and makes you feel happy and calm. And then your body's going to stop producing as much dopamine, which is a mood regulator. And that's what you get addicted to. And that's where you want to have that cigarette. 5 minutes of a moderate intensity exercise is going to produce the same amount of dopamine as a cigarette, which significantly reduces that craving. So if you are trying to quit, getting out and exercising and slowly reducing your usage so your body can start to produce that dopamine again on its own instead of getting it from that external source is going to help with that.
Great. There's 2 questions in here. One of them, someone is asking about obtaining nicotine patches for free. And I will also just kind of put in a shout out here too. We have a tobacco cessation program that's completely free, and people that attend that class can get free nicotine replacement therapy. So I'll kind of answer that one about the nicotine patches. That's an option to get some nicotine replacement therapy for free.
Yeah.
Then there's a question here, Jennifer, for you. Can nebulizers, rescue inhalers, and preventative medications such as Advair be enough to help with the wildfire smoke? They've had to rely on steroids the past 3 years with some heavy breathing pains, and they'd like to stop that.
Yes. So it depends on the exposure. So that's where reducing your exposure comes into play. But being proactive with those rescue inhalers and the nebulizer can definitely be beneficial. So any maintenance medications, so long-acting medications, your once a day or twice a day inhalers, those take about 2 hours to kick in before they'll take effect. And then they last 12 to 24 hours. So those will not generally help with a sudden exposure to something. Those are just going to help maintain your lung disease at the time. However, your quick acting, so your nebulizer, which would be your albuterol or what they call DuoNeb, or your albuterol inhaler, that can definitely help reduce your symptoms or help with symptom management. Generally, as long as it's prescribed this way, you should be able to use those every 4 to 6 hours as needed. They take about 15 to 20 minutes for full effect. So if you have wildfires in your area and you have to go outside, maybe you have a doctor's appointment or you have to go to the store, right? We still have to live our lives, unfortunately, in those moments. So if that is the case, you can use your inhaler or your nebulizer 20 minutes before you expose yourself to that. And that will help reduce the exposure. In the fact that it's going to help reduce how constricted your lungs become. So when you become exposed to something, what happens is your body releases a hormone, and that hormone binds to receptors in your lungs, which constrict those tubes, those bronchial tubes. When those get constricted, it makes it harder to breathe. So if you use your inhaler 20 minutes beforehand, that is going to bind to those same receptor sites, but it dilates. And when those are bound to that receptor site, it prevents that hormone when it is released from binding in that same site, which then reduces how much constriction you experience. So it can definitely help. However, if you're having inflammation from that exposure, that's where talking to your doctor, and that's where prednisone comes into play. Or you may be able to do like a a long-acting inhaled steroid, or even a short-acting. So that DuoNeb nebulizer, if prescribed by your doctor, has both a bronchodilator and a steroid in it. And that can definitely help with that inflammation in your lungs as well.
Great. These questions are great. Keep them coming.
Yes.
We've got one in here. How about specifically someone's asking due to COVID? Are there exercises or something else helpful for reduced lung function capacity as a result of COVID?
So it's going to be the same exercises as anybody with any lung condition, just cardio and strength training, improving again how effective your lungs or effective your muscles are If we can increase the effectiveness of our skeletal muscle, it reduces how hard our lungs have to work. And when our lungs are not working at full function anymore because there is damage in there, the more efficient that our muscles are, the more they can make up for that damage that has occurred in your lungs. So cardio and strength training. Again, if you're having prolonged symptoms after COVID, so the only requirement to attend pulmonary rehab, as far as Medicare goes at least, is that you have to have symptoms for at least 4 weeks after having COVID. There's no PFT requirements. You don't even have to have a positive COVID test in your medical record. It's just suspected. It just needs to be documented that either you had COVID or suspected COVID and continued symptoms for at least 4 weeks to be able to attend pulmonary rehab.
There's a follow-up question in here about the nebulizer that you were just talking about in the previous question. Can you buy a vapor breathing nebulizer over the counter, or do you need a prescription for that?
So you do need a prescription specifically for the medication portion of things, but I do know that the nebulizer components, so the tubing and all of that, is also FDA regulated and needs a prescription, or at least it did 5 years ago when I worked in home care. So that does still need a prescription from your physician to get a nebulizer. But if you have a chronic lung condition, usually that is something that they're more than welcome to or willing to prescribe for you.
Great, right. I think I have, oops, maybe not hit on all the questions. What is the value of humidifiers in the home when there is air pollution from smoke?
Yes. So humidifiers are great in your home regardless. I highly recommend having a humidifier, at least 1 or 2. So your house should be about 40 to 50% humidity at all times for our lungs, because again, they like warm, moist air. So if the air is really dry, it'll dry out our lungs, and those secretions become really thick and sticky like glue. So they'll just stick to your airway, and they can damage that cilia when they stick to your airway like that. So drinking lots of water and keeping your home at 40 to 50% humidity is going to be hugely beneficial for your lungs. The other big thing with wildfire smoke and humidifiers is it could, the humidity could bind to some of that and pull it out of the air a little bit. And wildfire smoke does have a tendency to dry out our air even more so than it normally is. So having a humidifier is going to help with the dryness of that as well.
Now I think that's all the questions that I'm seeing. If I'm missing any, feel free to just again shoot me another message in the chat. Otherwise, thank you all so much for attending, and thank you, Jennifer, for spending your hour here with us. We do these webinars every month. Next month, you're with me. We talk about diabetes and weight stigma, so really encourage you all to attend that one next month as well. And then otherwise, Jennifer, you and I will stay on here for just a few more minutes if anyone has any last minute lingering questions. But otherwise, thank you so much for being here and spending your lunch hour with us today.
Yes, thank you.